Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we learn about the newest mosquito-borne disease, Zika. It's official. Barbados has 3 confirmed cases of Zika. It may not be a familiar name to most, but it's certainly not new. Zika is a viral illness transmitted by the Aedes aegypti mosquito, which also spreads dengue and chikungunya. It was only detected for the first time in our region last year, but it was discovered in 1947 when a rhesus monkey in the Zika forest in Uganda developed an unknown feverish illness. Since then, outbreaks of Zika have occurred in Africa, Southeast Asia, the Pacific Islands, and the Americas. It's not as severe as dengue fever and chikungunya, but it has virtually the same symptoms: fever, rash, headaches, and joint pain. Zika victims also suffer conjunctivitis, commonly known as red eyes. The illness may last up to a week. Doctors are, however, concerned, particularly for pregnant women. That's because tests have revealed that the illness is linked to a neurological disorder that results in babies being born with abnormally small heads, causing severe developmental issues and sometimes death. There's no vaccine to prevent Zika or medicine to treat the disease. To relieve symptoms, it is recommended that persons drink lots of fluids and take pain relievers such as paracetamol. Authorities advise citizens to take every precaution to avoid being bitten by mosquito. Health Minister John Boy says Barbadians must destroy all breeding sites.
The fact that the Aedes aegypti mosquito, which transmits the Zika virus, is the same mosquito that spreads dengue fever and chikungunya. As a result, we are all very familiar with the prevention and control measures which we need to undertake to prevent the spread of this disease in Barbados. We can all use simple measures to prevent mosquito breeding around our homes, business places, and communities. The best way to prevent the spread of Zika virus or any other vector-borne disease is to inspect your surroundings, to search out and remove mosquito breeding places on your properties. The Ministry of Health recommends that this should be done once per week.
Simple measures include keeping water drums and barrels tightly covered and throwing out stagnant water from flower pots, old tires, and other containers that might act as breeding sites. Citizens should also protect themselves from mosquito bites by wearing long-sleeve clothing or long pants, using insect repellents, and sleeping on the mosquito nets. In the meantime, the Ministry of Health will also be stepping up its surveillance program.
The Environmental Health Department will continue to conduct mosquito surveillance, prevention, and control activities such as house-to-house inspections, surveillance at ports of entry, and fogging in high-risk areas. In addition, the Ministry will continue its epidemiological surveillance to collect and analyze data from various sources, including private and public sector facilities, on a weekly basis to provide information for planning and for response.
That's Health Today. Join us again next week.